I'm a medical doctor, graduated from the State University of Maringá, Brazil, and currently a master's student in emergency and urgent care. Let me share my screen. Just a minute. Okay. Okay, I should mention that my English might be a bit rusty as it's been a while since I've been presenting in another language. Okay, so I apologize in advance. If I need any help, I will reach out to those in the group who speak Portuguese, okay? I,
Course.
I'm very excited to be here with you all to present my article titled Designing, Development, and Validation of an App to Reduce the Response Time of Emergency Medical Services, which was published in the journal PLOS ONE. You can find the article using the QR code provided on the screen. So I will start it with an overview of the article, then cover some of the key points, and finish with the results and future applications, okay? So Emergency Medical Services, EMS, is a crucial healthcare system designed to provide immediate medical attention to individuals in urgent health crisis. It encompasses three primary functions: emergency response, dispatch, and patient transport. This flow chart represents the conventional call processing and response times for emergency medical services in Brazil. It details each step in the response sequence, from the initial call arrival to the delivery of the patient to a hospital. So the process begins when an emergency call arrives. The call is first answered by a medical regulation assistant telephone operator, the TARM, and the TARM gathers essential information by asking the caller a series of questions. What's your name? What is the victim's name? And what happened? And what is the address? And the question, what is the address, is highlighted as a critical question in our work, and we will call it T2D. After the initial data collection, the call is transferred to a medical doctor who evaluates the information. And the medical doctors decided whether an ambulance is necessary. If the answer is no, the process ends here. And if yes, the flow proceeds. If an ambulance is to be sent, the medical doctor communicates with the radio operator, who coordinates the dispatch of the ambulance. And the ambulance is dispatched to the scene and travels to the location provided. Medical assistance is provided to the patient at the scene, and after stabilizing the patient, the ambulance transports them to the hospital. The patient is delivered to the hospital, making the end of the process. But in many regions, the effectiveness of EMS is often hampered by slow response times due to communication delays and difficulty in location killers. Time response in emergency is critical as every second counts, particularly in life-threatening situations such as cardiac arrest or severe trauma. Delays in dispatching emergency medical personnel can significantly impact patient outcomes, often resulting in increasing morbidity and mortality rates. So geolocation technologies has the capacity to transform the emergency medical response framework by providing accurate caller locations almost instantaneously. And the integration of this technology into EMS can drastically reduce response times, allowing for faster medical interventions that are critical for survival in emergencies. The study aims to design, develop, and validate an application called Chamo 92. Chamo is call, chamo is in Portuguese chamar, that in English is call, and 192 is like 911. So chamo 92 means call 911. So we developed this app, which is intended to geolocate emergency calls effectively. And by comparing response times between conventional calls and app-mediated calls, we seek to understand the app's potential to improve services efficiently and urgent medical situations. The Chamo 92 app was developed using a structured approach centered around the design thinking, ensuring that user needs were integral to its creation. And data collection utilized a mixed method approach, including interviews with the EMS team members and surveys targeting public experiences in emergency. This comprehensive data informed the app design by pinpointing communication barriers and addressing information gaps in emergency situations. The design thinking approach guided the development stages: discovery, definition, development, delivery, and validation. This is a user-centered framework emphasizing understanding the needs of both emergency medical services and the public, ensuring that solutions address the real-world issues effectively. The development of Chamo 92 leveraged Flutter program for creating a prototype applicable to both Android and iOS mobile phones, combining diverse perspectives from EMS professional and public feedback. The development cycle was iterative, refining the app functionally based on ongoing evaluations. The validation of the mobile app involved using the System Usability Scale. The SUS scale is a quantitative analysis tool that consists of 10 items designed to measure the ease of use of a product in question. The experts rated items on a 5-point Likert scale, ranging from 1, I strongly disagree, to 5, I strongly agree. And the agreement between the experts' response was assessed using the content validity coefficient, the CVC. And the final score was classified into 6 categories, from worst imaginable to best imaginable. About the results, the section outlines the usability evaluation and the performance analysis of the Chamo 92 app, revealing its significantly advantage in both user satisfaction and response times in emergency situations. The Chamo 92 app received a SUS score of 90, which indicates a rating of best imaginable usability. And experts' evaluation highlighted its intuitive design and effectiveness in enhancing the clarity of emergency communication process. For better visualization of the SUS results, e-health criteria were adopted. The SUS items were classified as usability and performance, guidance and support, navigation and interface, information and structure, and satisfaction. The radar chart showed that the app had a positive evaluation in all criteria. For conventional call data gathering, we use a convenient sample of audio recordings of emergency calls received by SAMU, Regional Norte Novo, Paraná State, Brazil. And a sample of these calls were heard and individually analyzed using predefined categories of the Label Studio software. Of these, 2,326 were classified as urgent and emergency, and 350 were reproduced again to define the time spent by call takers to gather information on the caller's address, the T2D that I show in the flow chart. And this was the control group. And for data collection from the app, the project team carry out the EMS activation test by performing tests calls via the geolocation app at 201 different locations in Maringá, Paraná, Brazil, using Wi-Fi or mobile data from different telephone operators. In comparative tests, the median response time for the control group calls averaged 35.67 seconds, while the Chamo 92 app showed an impressive response time of just 0.20 seconds. And the Chamo 92 calls has had significantly lower response time than control calls, as assessed by Wilcoxon main Whitney test. And this is a box plot chart of the results. This stark contrast showcases the app's capability to streamline the emergency response process. The Chamo 92 app shows significantly promise in reducing emergency response time through geolocation technologies. And its usability rating suggests a strong effectiveness in enhancing emergency medical services. The implementation of the Chamo 92 app significantly reduces the time needed for emergency medical services to acquire geolocation data, and this improvement in the acquisition speed enhances the overall quality and efficiency of the emergency response, indicating high potential for real-world application. Sorry, I speak super fast, but I would like to express my sincere gratitude to Professor João and Luciano de Andrade for their invaluable guidance through this work. I will also extend my thanks to the researchers from the study group on digital technologies and geoprocessing in health, GETS, at the State University of Maringá, as well as the Duke Global Health Institute and the Duke University for their continuous support. And finally, a special thanks to the Global Emergency Medicine Innovation and Implementation Research Center for this opportunity to share my research with you today. So thank you all for your attention.
Thank you, Julia, very much for the presentation. Okay.
I don't know how to stop the presentation.
That's okay.
Stop share here.
Yeah. All right. Any questions? Hey, Julia, so while folks are thinking about questions, how has this been received by the City Secretary of Health? I know that Luciano has had some engagement with the, yeah.
Okay, so first we made a presentation to the secretary, and they thought that this is an incredible app, but they need a lot of research to say that, to put in practice, okay?
Okay.
So right now they said that they cannot use the app without a lot of research and tests.
what research on the applicability of the app or the efficacy of the app? What was the research they think they need to have done?
They thought that the population are not going to download the app and call to 911 using the mobile phone app. They will prefer just to call 911 in a conventional way. So they thought that we need to do a lot of presentation to the public and say that with the mobile phone, you can say your geolocation faster, because the problem is not the median group. The problem in delays are the people that takes 5 minutes to say their location or 6 minutes to say their location. So that's the problem. And the most part of the population can say where they live. So they think, I don't need a mobile phone to say that for me. But if you are on the street, you probably are not going, you are not going to know your address. So
Yeah.
they say that we need to do presentations to the public, so they would like to download the app. So right now, it's not an applicable thing to do.
Yeah, so the benefit of the app is to automatically share the location through the phone's location. But then you need the user to take up on it. So that is part of the implementation question, or it makes me think that on the design thinking phase, we might not have included all the needed stakeholders to design it, and therefore it's user-centered, but maybe on the technology side and not on the user side necessarily. That it's part of what needs to be redone as a proof of concept that we can use the cell phone location to trigger a direction or the pathway for ambulances, and that would reduce response time. That makes sense, but I think there's definitely more research needed to be done on how this can be implemented as a tool.
Maybe Julia, congrats on the presentation and the work. Maybe something to think about is, since the community is asking for you to do this education and training, maybe trying to see this as like a bystander intervention, or like for places where you have community gatherings like churches, community groups, training people there to use the app whenever an emergency comes. So people are gonna be, like, if someone is having a stroke, they're gonna remember to use the app, and is gonna immediately take the location and then share that with the emergency medical services, rather than the like a general population having to download the app. Maybe that's something that would be more of a measurable thing, because they're gonna be targeting those community groups as well.
Yes, thank you. That's an incredible idea.
Yeah, I'm also just thinking, well, I guess the next research, Julia, for Luciano to do is think about this from an implementation science perspective and consider thinking how this proof of concept technology can be embedded into something that is more feasible. So I know Brazil has invested a lot of money trying to build apps for social security, for access to governmental information. If you can somehow embed this with a, I don't know, protection app or an announcement app that the city uses, something like that, might be more straightforward. Or maybe this needs to be triggered by the call. So instead of the app, the call triggers the system on the cloud that then shares the telephone location instead of having the app necessarily. Yeah.
Unless the app is able to give something else that people need, right? Like, is there something that people need when they're using, or they're in this situation that they need to have access to? So whether that's transportation or something else, where they receive something else, not just making them.
Gives them another reason.
Yeah, it gives them another reason to streamline this process.
Yeah, there's something I always keep thinking about is more on, there's a problem to be solved, that this problem that they are solving now is from the access perspective. So it's not from the user perspective. From from the user perspective, I think the user is much less worried about
Where I'm at.
the improvement in time and more worried about receiving care. And maybe there's something around the family that if you use the app to call 911, the family can monitor where the event happened, where they took the patient to, so that it's easier to track the information.
But then it's
Yeah.
solving a different problem, right? So we have to make sure that problem is there.
Yeah.
Yeah, for sure. I do like your idea of integrating it into the cloud system so that it happens automatically.
Yeah.
But then obviously it won't be selling an app, it'll just be an automatic process.
I don't think we want to sell,
Okay.
Unless-
Then you often need
Yeah.
like permissions and things like that, if they're not getting an app just for that purpose, they have to like okay that. Like there was a COVID tracking app, like
Yeah.
where it used
But no one,
Bluetooth.
no one.
But which would be incredible if everybody was using it all the time, but that requires you both to download the app. Say it's okay to track me and stuff on the app and have your Bluetooth on.
Yeah.
When
When
you
it was around.
when you were around people or your location system. I think it was Bluetooth because one phone would have to know it was like near another
Well,
phone or something.
I'm thinking more about the knowledge transfer here, so
Mm.
imagine if Koishi has this feature in it that ties Koishi to the taxi drivers, so that whenever a patient is flagged on Koishi by the healthcare provider who needs to use the app, then that connects to the taxi drivers, and then that makes the link in taxi that you can find the closest taxi driver or whatever.
Yeah.
And then you can monitor the transfer of the patient until he reaches care. Like this could be an interesting.
If it's somebody that doesn't need immediate care, right? Like if they don't need a physician transfer. If they need a physician transfer for immediate care, then it would be different.
Well, we're talking about Tanzania, doesn't necessarily have that.
Correct.
So that's the point I'm making, is always you maybe use something like this to connect with the lay transportation system we've been trying to do
Yeah.
with
Yeah, that would be perfect.
Tanzania.
Yeah.
So the technology is there, it's proof of concept that it can be used, we have to think about ways of translating it.
Love it.
Very cool. Any other final questions, comments, thoughts? Anything else you'd like to add, Julia?
I have one ask, but maybe I will need to speak in Portuguese, but ok. Oi, Júlia. Bem, a pergunta é se tem em Maringá tem algum aplicativo semelhante ao que temos em Curitiba, que é o Saúde Já Curitiba. Nele tem nesse aplicativo você marca consulta na unidade básica, vê a questão de vacinações e tudo mais. Aí, se existisse um aplicativo como esse em Maringá, você não teria como implementar o seu aplicativo dentro dele?
Okay, let me just translate, Julia, before
Okay.
for the audience. So Bruna is asking if Maringá, the city where Julia is coming from, has something similar to what Bruna knows that exists in Curitiba, another city in the same state in Brazil. It's an app that allows you to have more of a EHR perspective to public health, so you can schedule your
Portal
health
app.
appointment. It's kind of like a portal to integrate with the public health system. And so if such an app exists, then it could be linked to that app.
That's exactly what I was thinking,
Another
Bruno.
problem. Yeah.
Yeah.
So Julia, what do you think?
In Maringá, we don't have this app, okay? But we have another app that is called Siga, that is used to find where the ambulances are, but just to the use of the SAMU. So
Mhm.
people cannot use this app.
Okay, I ask because the interesting thing about this app in Curitiba is the doctors introduced this app for the patients, and now all the patients love it, the app, because you can find all your vaccines. You can find when I can take one a consult with my doctor, and I love it. All my patients love it, this app. And when one patient say, I need book my consult in the unit in the unidade básica. Other patient, no, you take the app and it's great. And now in few months and only in a few time, all patients in Curitiba know the app and working. And if in Maringá have one app similar, your app can integrate. Yes. And because for Curitiba, your app is amazing, is incredible.
We know that if we can make just one app with all the plugins, this will be perfect. So you can book your medical consults, you can see your vaccine calendar, you can call 911. This should be an incredible scenario. But there are a lot of people and each group made just one app and we don't know how to integrate all the apps. So this is an incredible scenario, but right now we don't know how to do that. But it would be amazing.
Yeah, I agree with Bruna. It gets right to that point that Catherine was saying of like, we need to give people another reason to use this thing and get that, so they get something out of it, which motivates them to have it. And I would expect, Julia, that kind of thing to become common in Maringá very soon, because that's becoming popular any place that it's used, I think. Users like it, as Bruna pointed out.
Okay.
Very interesting work. Let's thank Julia for presenting to us today. Thank you, Julia.
Yeah.